Well, good morning, everyone. Thank you for attending our protest in support of the Ontario Health Coalition and its fight for public, quality, accountable, and transparent health care in our province. My name is Folgo Della Vedova, and along with my colleague David Harrismew, we are the co-chairs of the Sault Ste. Marie Health Coalition. There are too many healthcare concerns and serious problems in our community to properly address in a period of 1 hour, so today we will publicly focus and protest on two main issues. One is the healthcare portion of the Provincial Auditor's Report, and two, the unacceptable conditions and lack of healthcare facilities and services of our current and to-be new hospital.
This is one more attempt by the Ontario Health Coalition to derail plans for our new Sault Ste. Hospital project, which is on time and on budget. And in fact, there was a value for money audit done by an independent organization, I believe it was Deloitte & Touche, that did the third-party review of the plan, and they indicated that, in fact, building the hospital through the alternate financing model, as we are, which has allowed it to stay on time and on budget, is going to save taxpayers 18% of the total cost of the project. So we think that's tremendous value for money.
It was not so very long ago that Mr. Rossetti and some Liberal supporters in our community accused the Ontario and Sault Health Coalitions of uttering false and fear-mongering statements regarding the Liberal government's P3 hospital deals and healthcare delivery. Their tactic was to discredit us and describe us as anti-new hospital rabble-rousers. Well, lo and behold, the key findings and recommendations of the Ontario Auditor General's Report, Chapter 3, released December the 8th of this year, not only supports the Coalition's claims, but provides ample, detailed evidence of how flawed and wrong Mr. McGuinty and his Liberal government were in their P3 financial deals.
As opposed to doing what has been done in the past. And as we know, there have been huge cost overruns in the Sudbury Hospital, about $300 million over budget before they actually had to stop construction and before the project had to get reworked. In Thunder Bay, the project was about $100 million over budget. We can't afford that kind of fiscal irresponsibility when it comes to taxpayers' money. And the Health Coalition is misguided in their views. They're irresponsible and they're fear-mongering, quite frankly, because they don't have the facts.
Of the Ontario Coalition's tireless research, solid claims, strong evidence, and poignant warnings fell on deaf Liberal government ears. Now the Ontario Health Coalition is vindicated in the Auditor's Report. And just for definition purposes of P3, it is the public-private partnership financing in which a for-profit consortium finances, builds, and privatizes support services of a hospital. That's what we're talking about here. Based primarily on the Brampton P3 hospital model and state of affairs, the Auditor's Report presents the following key findings. 1. Cost increased from an initial $357 million to a final $614 million, almost double, and the hospital size was reduced. Cost estimates were seriously flawed. Number 2, higher rates of interest charged by the private sector consortium, P3, meant that the hospital costs $200 million more than if financed by traditional government procurement. We warned them. Number 3, costs for consultants were exorbitant and unnecessary. $28 million ascribed to the P3 deal out of the $34 million that was spent. It should have only cost around $6 million. Number 4, $63 million could have been saved if the hospital did not have to make modifications to equipment and reduction in size of the facility. Less beds, for example. Number 5, and here is the Liberal public deception one. The value for money comparison document between the public procurement cost and the P3 privatized cost overstated the public approach by $634 million over the life of the contract. This overstatement was then used to justify the P3 privatization deal and policy, of course. The comparison was seriously flawed.
Well, what I can tell you is that we have, since 2003, invested 37% more for healthcare funding. So we're up to around $45–46 billion now, about half the Ontario budget is spent on healthcare. And since we've come to office, we've increased funding for healthcare by 37%. We've also increased the medical capacity in Ontario. There's about 680,000 people in Ontario today that have a family physician, as opposed to 5 years ago who did not. When it comes to physician supply, we take that issue very seriously. We're reversing some irresponsible decisions by a past government. Some of the folks outside are part of the federal NDP Riding Association, you know, when the NDP was in government, they cut the number of medical spaces in Ontario, and you know, some of that is catching up with us today.
Sault Ste. Marie Health Coalition is dedicated to bringing awareness to the people of Sault Ste. Marie area of healthcare issues that are not being addressed by our community leaders and politicians. It has become painfully clear that the present government has not funded the hospital budget, even though we have been paying a health tax that has sent millions of dollars back to Toronto. The $15 million deficit means healthcare services are going to be cut as we speak. And if we don't speak up now, when these services go, they will never come back. For example, your oncology bunker will be just a pile of cement. If we cannot attract more oncologists, and the hospital is making that very difficult at the moment.
We are taking action to try to correct that. We have doubled the foreign trained spaces in Ontario from 90 to 200. We've increased capacity at the 5 existing medical schools in Ontario by 15%. And we've also built a new medical school right here in Northern Ontario, which will see its first graduating class come this spring. So we're doing all that we can to try to get more capacity into the system, create more doctors, quite frankly, work with the College of Physicians and Surgeons to allow more U.S. physicians to come in and practice in Ontario when they meet, obviously, certain criteria and standards.
We are not making excuses for the hospital's management and board. They continue to mislead the public. They have a code of silence with regards to staff speaking out negatively to the public. In fact, staff are being disciplined as we speak for speaking out about the oncology department.
Dr. Wald has done an exceptional job throughout his career, and as you know, he had indicated some time ago that he had planned on retiring in the new year. He is obviously expressing some challenges here, and he's I think worked very, very hard for this community and has been a tremendous asset. He's going to be tough to replace, whether it's in March or whether it's in August, and we're going to need to continue to work very hard to bring new physicians to our community to fill his shoes. And it'll probably take 2 people to fill his shoes because he's been such a tremendous advocate of healthcare.
These are people we elected who should be fully concerned about the health care delivery that we have in this community. Really want to thank you very, very much for attending and for supporting us in this matter. Thanks so much.